And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, now, good day. Welcome to Boomer Life on CIL 650. It's Tom Lucas. I've taken my real estate hat off and put my tooth on.
Your tooth?
I'm growing another one. It looks pretty good, doesn't it?
I like it.
Yeah. Dr. Birdie, it's good to see you. You've been away for the last few shows.
I've been running around.
I know.
I appreciate Ron holding up the ship and keep going. But yeah, I'm glad to be back.
Nice to see you again. And you have this Movember thing happening?
I'm trying to.
Last day?
Last day. Well, no, I'll probably keep it till Sunday. Try to be true. I'll wait till the 1st.
Dr. Ron, he looks pretty good in that thing.
Yeah, he's black on black here.
I was down in your office, a week or so ago, and didn't recognize you.
Oh, that's how it is.
Yeah. He's just got this beautiful thing on his face.
Yeah.
But it's for a good cause.
And it's shorter, a little bit shorter than it was the other day, actually.
I thought so, yeah. And didn't you have the thing happening under the chin, too? Or
Yeah.
Yeah. No, that I like. It's got the mustache, kind of a Fu Manchu kind of thing.
That's right.
Looks pretty good.
Yeah, trying to trim it up. Trying to shape it up a little bit every month, and it's good.
All right, now on the real estate show, we always talk about people maybe making a move for a home, and if they do everything and it all comes together really quickly, they might have an opportunity to be in for Christmas. Let me ask you, gentlemen, if somebody has something going awry in their mouth, is there any possibility of fixing that up before Christmas?
Possible. Until we find out what the reason for the problems that they have, we don't know. So we'd have to do that examination and figure it out.
So it depends on what it is.
Absolutely.
Yeah, a lot of emergency stuff can be taken care of, but some of the other stuff, it all depends on, there's only so fast we can go because of the body and the way it heals, so it just takes time.
Well, at Christmas time, families get together, people have a good time, people are kind of laughing, kind of smiling, they take the family pictures, and inevitably there's somebody that's hiding behind a hand or a piece of cake because they're afraid to smile, right?
Absolutely.
You get many of those people?
I think we get a lot of them, don't you think?
Yeah,
Well,
I
for
think
sure
so.
we do. And it's interesting, the people don't really appreciate it, but when they put their hand in front of the face, they draw attention to the poor smile. And if they just smiled without drawing their hand up there, many people wouldn't see the problem as quickly.
And of course, with Christmas time, too, people like to eat. And when people are having problems with their teeth, sometimes it's hard to eat all that good food.
They find a way.
People find a way. Oh, yeah.
Even if I have to take my turkey intravenously?
That's right. Even if they got to blend it up, even if they got to do whatever they got to do, they'll eat it. Trust me. The food is too good around this time of year.
We often talk about BC Perio Dental Health and Implant Center as a great place to go because it is. And we talk about teeth in a day. Tell me about teeth in a day. How does that work?
Well, teeth in a day is something we've been doing a lot of. We've been doing a lot of it in the last few weeks, even for people giving them brand new smiles for the holiday season. But really, what it means is it can be anything from one tooth to a whole set of teeth, where you come in and we're able to place some dental implants and give you a fixed set of teeth in one day. A lot of times, one visit. So it just depends on the situation, but it's a great service because people get to go home with teeth.
That's a nice thing.
Really
That's a nice thing. Let's just pretend there's somebody who hasn't ever heard you gentlemen on the radio before, and God knows where they come from, but you guys have been around for a long time. Dr. Ron, tell us a little bit about yourself.
Oh, good Lord. I've been around a long time. I graduated from the University of British Columbia in 1974, practiced with my father as a prosthodontist for 20 years, went on to do surgery after that, and have, for the last 15 years, or maybe a little bit more now, have been holding down a practice in implant reconstructive and surgical and prosthetic reconstruction, predominantly on implants. And that plus developing the Pacific Implant Institute, lecturing here and there, Venice, Rome, South America.
Oh, yeah.
There's a lot of stuff going on. And it just never stops.
So
then I get the pleasure of having Dr. Birdie here come into my life, and it's been a strong growth from there and very enjoyable.
Now, before Dr. Birdie did this, we used to know that used to be a linebacker for the Edmonton Eskimos, weren't
You know what? I grew up loving the Eskimos, but I wasn't a linebacker, no.
you? Maybe in another life.
Another life, exactly.
So now how did you get involved with this?
You know what? I went to school. I went to dental school in Saskatchewan, went down to the States, did a couple specialty residencies, came back, and was able to provide services for patients. And I met up with Dr. Zokol, with Ron, a few years back, and we had a few conversations, decided we wanted to work together, and I was able to collaborate a few other people and build BC Perio. And with that, we've got 2 offices now, and we're all working together. The best thing about it is we're all working together to provide the highest level of care. It's cutting edge stuff, and really we're providing the best care that we can.
You mentioned a couple of locations, Vancouver, of course, and Coquitlam.
Yep.
Can you do us a favor? Can you give a shout out to the other doctors that work with you guys?
Sure. So we have Dr. Peter Munns, who's working with us. He's a long-standing periodontist in the Lower Mainland. He's been working in Coquitlam and Vancouver for a long time, and just a really good clinician. We have another periodontist who's Dr. Josh Kleinman. He's been working in Vancouver for many years as well. Been around a long time and does great work. And then we have Dr. Tim Gould, who just recently retired. He's retired about a couple weeks ago. We actually miss him already. And he's been working for the last 35 years in the Lower Mainland. He's very well decorated as a periodontist.
So let's give the addresses. In Vancouver, you're at Suite 501-777 West Broadway at Willow.
That's right.
And your telephone number at that location is 604-872-0222. In Coquitlam, I had that problem on the last show. I forgot to turn it off, too.
Remember.
Maybe somebody needs maybe the freezing's coming up. 250, 1175 Johnson Street, and that's at Glen Drive, and that's in Coquitlam. And your telephone number at that clinic is 604-936-8244. Let's talk about your consultations. First of all, I guess because Christmas is coming up and money could be tight for a lot of people, how much does a consultation cost?
It's complimentary.
As in free?
As in free.
Holy cow. Okay, I like that so far. So I go down to your office, I make an appointment, I come in and see Dr. Bobby Birdie or Dr. Ron Zokol. I know it's going to be free, so you're going to get me in and out as fast as you can, right?
No, we set aside a good set of time to do a very thorough consultation, and it involves a complimentary consultation and a lot of times a complimentary 3D cone beam CT scan.
So you don't do x-rays anymore then?
Well, we do x-rays, but what we do is CT scans it's three-dimensional on the computer. It's much more thorough for times, and we're really able to go about it, so it's great.
Now you're laughing at me.
Yeah, just for clarification, a CT scan technically is an X-ray.
That's what I thought.
Yeah, it's a type of.
Yeah.
But it's one of the most sophisticated X-rays you can do, and it gives more information than any of the other type of X-ray systems.
So it shows what's going on in there for sure.
In 3 dimensions.
And it shows who's been in there before you guys.
Not chance.
Because I know that you do take care of some problems caused by other people. Sometimes it happens.
I think it happens for everybody.
Mm-hmm.
You know, and being a specialty clinic where we have multiple specialists in the office, and myself being really the only certified dual specialist in Western Canada, it's a lot of my practice. You know, a lot of my practice is things have been started, things have been attempted, or things are not working as well as they should have, and they get sent to me to fix. Absolutely.
And we've been doing that a long time. And the reality is that anybody who does surgery or advanced prosthetics or something like this is going to make an error from time to time. The question becomes, we're human, and there are limitations within the system. The question becomes, based on if you have really, really fine training or you have a lot of experience and growth in the field, the object is to minimize any of those things and to get as close to optimal results as you can possibly get. That's one of the things that I think that we have a strong value for.
A couple of shows ago, we had a gentleman call in who was having severe pain in his mouth. And Dr. Zokol, the first thing you said is, before we do anything else, let's take care of that pain.
That's right.
Because when somebody's in pain, they're not a happy camper.
Well, not only that, but they can't think straight as to where the best solution should be in the future.
Yeah, the decision-making thing is really difficult. When someone's in pain, that's the biggest thing they want to get rid of, and everything else is secondary. So that's what the first thing we try to do is get rid of that pain.
Yeah, one way or the other, we get rid of that pain and then we go from there, right?
Absolutely.
And again, those consultations are gratis. They're free. Yeah, Merry Christmas to you.
That's right.
Our telephone,
Santa.
Yeah. 604-280-0650. If you have any problems in your mouth or you know somebody who does, or you may have a question for our good buddies here, give them a call. Dr. Ron Zokol is with us and Dr. Bobby Birdie. If you live out of town, we have a toll-free line available, 1-877-280-0650, 1-877-280-0650, toll-free from anywhere you can hear us. And locally at 604-280-0650. Now, our producer, Dwayne, on the program, nice guy, but he's got a little bit of a problem happening in his mouth. Maybe we should let Dwayne, tell the doctors what your problem is, and we'll see if we can come up with a prescription and a cure for you here.
Well, hello, guys. How you doing?
Great, Dwayne.
Excellent. My problem, I guess, is I have 3 of my wisdom teeth that are coming in, and you can't... Can you guys hear me?
I can hear you.
Oh, okay. Oh, that's weird.
Dr. Birdie can't.
That's kind of weird.
So we'll send him to the ear doctor after the show. That's okay.
You got it. But
I don't mind.
But back to the teeth there. I got 3 coming in, and 2 of them are, I forget what the word is, but they're coming in like
they're impacted.
sideways.
Oh, no.
Impacted.
No.
Yeah, is that the word?
No, it's the wrong word.
Could be. Could be.
Yeah, they're coming in like totally sideways. Like...
They're sideways, yeah. That's impacted.
Oh, okay, yeah. So, what's the dealie? How do we go about getting those bad boys out?
Well, that's for us to do.
Nice.
Now, the thing is, with some of those, what we call horizontal impactions, or teeth that are tipped, the third molars that are tipped towards the front, and they engage the root of the tooth in front, that's a risk. And if they also extend partially through the gum tissue, then you have a bacterial factor as well. So we have things like a bacterial invasion of that area that could be a problem. We could also see bone loss around that area, and sometimes we can see damage to the roots of the tooth in front. So those impactions are often recommended to be removed.
Yeah.
So now what would happen? Let's say Dwayne's like me. He's kind of a scaredy cat. I like dentists, as other guys I don't like. But dentists are cool with. I'm cool with that. But let's say he is getting a little nervous and he says, "Oh, gee, maybe I better not have that done." What could actually happen to him down the line?
Well, he could lose that tooth in front quite easily, or put its life at risk, and he would end up losing the impacted third molar as well at the same time.
One of the other things that could happen is that, because if it's starting to come through the tissue a little bit, and it becomes a bacterial invasion, you can get an infection called pericoronitis, which would make it really painful for him to open his jaw, and painful in general. So it's not a fun one to have. So if you've got an issue, it's much better off. You're much better off getting it taken care of.
Maybe what you should do, Dwayne, is Monday, call the office, make an appointment. The consultation is free.
I think that's going to have to happen.
Because if he doesn't do that, I could end up having a new producer on the show. I'm just getting used to this guy here, too. So if you have a question, our telephone number is 604-280-0650. You can talk for free to the doctors here. That's what they're here for, 604-280-0650. Out of town, 1-877-280-0650. That is a toll-free call from anywhere where you can hear us, 1-877-280-0650. We're listening to Boomer Life on CL 650. We're back with the good doctors and more in just a moment.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at ShannonOaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
CL 650.
A smile is just a frown turned upside down, my friend. So hear me when I'm saying smiling faces sometimes. Hey.
Yeah, smiling faces sometimes. I can't believe this. I actually saw Dr. Ron Zokol getting down.
Yeah.
Getting down.
Those are good dance moves. Those were old school
That's
stuff.
old school stuff, yeah.
Hidden stuff.
Believe how small a space we have here for dancing.
But you're doing a fine job. You're doing a fine job. And at your clinic there on Broadway, it's a fairly new building. You've got a great new office. Lots of room for dancing in the hallways there and in the reception office.
Oh, there's lots of room.
Free
lots
coffee, free view
for lots of people.
Lots of people. During the break, Dr. Birdie and I were talking about some of the things with Christmas coming up. The end of the year is not far away too, and we were talking about insurance plans.
Absolutely, I think a lot of people are coming towards the end of the year, and like with anything, when it comes to people do this for glasses and everything else, is that dentistry is no different. So I'm sure some people are trying to maximize their insurance plans before they reset by the end of the year, and if that's the case, then it's a reason to come and get that complimentary consultation.
So just to make things clear, you do work with insurance companies.
Yep.
Good. That's good to know. Now, people are listening to you for the first time. They're thinking, yeah, I've got a few problems in my mouth, but you know what? Hey, my God, I'm 85 now. I'm kind of old to be going and seeing the dentist, so maybe I should just forget about this. What would you think of somebody like that?
You tell it to the 94-year-old that was in recently and got a new set of teeth.
Really?
On implants.
Really?
Yeah, tell them that they're too old. This is about quality of life and how much you want to enjoy the quality of your life. And age is not a factor when it comes to rehabilitating your dentition.
Yeah.
Yeah. You mentioned on the show some months ago too about you had an older lady come in. You fixed her up. She's all happy. She went on a cruise and came back with a 22-year-old guy.
That happens.
It do.
That happens.
20 years her junior.
Wow.
Yep.
Amazing.
That's amazing. And let's go to the other end of the scale. You have to be, was it legal age to come and to see BC Perio or?
No. We'll see anybody, but if you're a minor, we'll have to have a signature from parent.
Oh, okay.
Yeah.
But the truth of the matter is most of our work is not done on young adolescents or anything like that. But if you're 15, 16, 17, some people are born without teeth or they're partly through orthodontics and they want to plan for their future and they want to see what can be done if they don't have teeth in certain areas. Not a bad idea to get a handle on it early, even though you may not actually treat that person, but at least you can coordinate with the orthodontist and whoever so you can set that person up so when they're old enough that they can have their teeth put in.
So I guess then a lot of people that have problems with their teeth don't necessarily have problems with their teeth because they didn't brush 3 times a day.
Not always. You know, it's one of those things where I think oral hygiene is really important. I think, there's a reason why we say brush twice a day, floss once a day, do those types of things because, having plaque and bacteria around your teeth is not the best thing in the world, and especially bits of food. But there are many people that they're the ones that'll be listening saying, well, guess what? I brush my teeth 3 times a day and floss my teeth all the time, but for some reason I have this periodontal disease thing and I've got to get my teeth cleaned by a hygienist every 3 months. So there are some genetic and other factors involved as well, but overall if people take good care of their teeth, brush, floss, do those things, it really does the job.
What happens if somebody flosses all the time and they get bleeding gums?
Bleeding gums are indicative of not cleaning effectively enough.
Oh.
Yeah, and let me go back to the brushing factor, because I think one of the things that people will say, and we say, well, you need to clean your teeth. Well, I brush my teeth 2-3 times a day, whatever. They may get a brush in the area, but maybe it's a technique that they have, and this is what our hygienists do. They will actually look and observe how you brush, and they will guide you to more effective brushing. So for whatever time you spend with a toothbrush in your mouth, at least get it doing the proper amount of work, and that's a problem for some people.
So you mean I go down to your clinic and somebody watches me brush my teeth?
Yeah, they'll show you that.
Really?
Our hygienists they take a lot of pride in what we call oral hygiene instructions. So they'll sit down, they'll go through different flossing aids, they'll go through how to floss, they'll go through how to brush, different techniques, different electric brushes that we would recommend. They take a lot of pride in what they do, and they do a very good job. So I would be more than happy to have anybody come by and ask a question. It's a great situation, absolutely.
So all toothbrushes and toothbrushing techniques are not the same or correct?
Absolutely. There's different brushes, different techniques, different strengths of bristles, even different toothpastes. There's a lot of variation in a lot of this stuff, and more of it's marketing from a business standpoint than it is actually what's needed. And what is actually utilized.
Yeah, we talked about somebody who came in the other day, and the tops of their teeth where they bit down were clean as a whistle, but all that area around their gums inside of their teeth had a lot of debris on there. So here's a person who's brushing his teeth, and he could have the worst toothbrush with the best technique is going to do better for you than the best toothbrush with the worst technique. In his case, didn't matter because he wasn't getting to the right spots. Because what we say to get more effective and to get more highly effective is don't brush your teeth, brush your gums. Brush where they contact your teeth. It's your gums that are the key.
And do the back sides as well.
Oh yeah.
The front side everybody sees, it looks nice. Do the entire tooth.
Absolutely. And don't be too aggressive.
No?
Otherwise you end up seeing me as a periodontist and have to get things like tissue grafts and stuff like that. So we want to make sure that things are you don't brush too hard either.
Tissue grafts, bone grafts, there's nothing that you guys can't do.
We do a lot of things in our office, absolutely.
Very true. It's very close. And the things we can't do, we got excellent specialists that we refer to that work in harmony with what we do.
So you take this X-ray of people. That's the wrong word. What is the proper word? Not X-ray. You just mentioned it before. CT scan.
That's right.
CT scan.
Yeah.
And you can see in 3D what's going on in somebody's face, and you look and you say, yeah, well, you're brushing, but you do have problems, and then you say, on the computer, you print up a little course of action.
Yep.
And costs and everything, and people are free to do it or not do it, right?
Absolutely. We actually do give someone a step-by-step, visit-by-visit breakdown for an estimate, and they're able to, there's no obligation whatsoever. It's just their right to be able to know what their options are, what they can do, and what things will cost. And then if it's amicable to them, then we proceed.
And I know too that you lay it out. It'll be like 3 visits or 4 visits, and you can actually guarantee that's going to be 3 or 4 visits, right?
Mm-hmm. Well, most times we can. There are always some things that change along the way, but most times absolutely we can do that.
It presumes on normal healing and everything happening as we anticipate it does on a normal basis.
And I guess everybody is different. They heal quicker, slower.
Some people do. Based on their medical history, if they're taking a lot of medications or they have some issues with their healing, people who are diabetic, people who are smokers probably will take a little bit longer to heal, what have you. People who abuse a surgical site may open up incision lines, and it may just take a little bit longer to heal. They'll heal, but it really depends on how cooperative they are and what their medical background is.
You've heard the expression "physician heal thyself." Do you ever have people that come to you and say, "Well, I've looked it up online, and here's what I have," and they try to tell you guys what's going on?
Every week.
Really?
Every week, people come in, and it's actually great. The reason being is because, yes. I think Ron got to practice in the days where you went to the doctor or the dentist and you just, what they said you did and you moved on. And now I think with lots of the stuff on the internet and lots of things that YouTube and things that they can listen to and read and learn about, they come in much more informed. We normally have to clarify a lot of things for them and make them understand. Because sometimes a lot of times you read on the internet's not true, but besides that, I think they're coming in more informed and they're much more involved in their treatment, which is nice.
Yeah. So this morning, we by the way, we do have telephone numbers. We have a couple of guys here that just know their business. Dr. Bobby Birdie and Dr. Ron Zokol with BC Perio Dental Health and Implant Center. If you have a question or a thought, or is there something you'd like to know about your teeth, maybe give them a call now. It's free. Just like the initial consultation at your office. It's free.
That's right.
That's right. You give a better answer when they come down to see you, of course, but on the radio, because we're sort of strapped for time. But 604-280-0650 is the local number, 604-280-0650. And if you're out of the local dialing area, it's 1-877-280-0650. bcperio.ca on the internet, where you'll get the truth, unlike some other sites. And 777 West Broadway is the physical location in Vancouver. Broadway at Willow, Suite 501, 777 West Broadway, 604-872-0222. And if you live out in Coquitlam and would like to make an appointment out there, it's number 250, 1175 Johnson Street at Glen Drive in Coquitlam. And their telephone number in the Tri-Cities, 604-936-8244. More with Dr. Birdie and Dr. Ron Zokol coming right up.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CIL 650.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
CI 650.
Gray skies are gonna clear up. Put on a happy face. Brush off the clouds and cheer up. Put on a happy face. Take off the gloomy mask of tragedy. It's not your style. You'll look so good that you'll be glad you decided to smile.
Did you have that guy write that song about BC Perio? Because I hear that song and I think of Dr. Bobby Birdie and Dr. Ron Zokol. It's a great song. Kind of sums up what you folks do at your office.
Well, and we don't do our work purely for cosmetics. It happens to be a side effect. Just about everything we do is you make it look good.
So you obviously enjoy what you're doing.
Oh, sure.
Absolutely.
Take a lot of pride in it.
Absolutely.
Dentistry is an art form at this level.
It is.
Very much is. You have to know your science, but the quality of the end result is an art form.
Let's talk about the guy that goes to his average dentist and he goes in and has a filling, and next week he's got to come back and he's got to have a root canal, and the week after that he's got to have a crown put on, and the week after that and then it goes on and on and on and on, and it never stops. He comes to see you. What happens?
I've seen this so many times over the years, and I find that several things happen. When that happens, and the dentist realizes that no matter what they do, they can't seem to get a handle on it, that's when I'll get a referral to treat more comprehensively. Or sometimes it may happen for people, and because you put a lot of force on your teeth and there's bacteria involved, deterioration can happen. So if you patch a little here, and every time you come into the dental office, you find that you've got another couple of crowns to do, or then now you got a root canal, oh, you got to have that tooth taken out, then you got a couple more, then you got a bridge to do, and it just never seems to stop. It was incessant. Every time you go in, you got a significant bill, and you say, there's got to be an answer to this. There's got to be a point where you can be treated and say you're good for 10 years plus, reasonably. And that goes to very comprehensive care. So I put this out to the people listening, is that if you fall into that category where you seem to never have no cessation to always having more work done and more work done, let's have a look at that, because there are things that we can do to treat people like that and get them stable so that they don't have deterioration at the same level as they used to.
This will sound like a crazy question to you, gentlemen, but let's supposing there's somebody listening. It's probably a guy, because women always go to the doctor and to the dentist because they're just like that. It's in their beings to be like that. But guys are different. We usually don't go unless we need to go. Let's say there's a fella comes to see you. Maybe he's in his early 60s now, and he hasn't seen a dentist in years, and he's a little embarrassed to see you. Should he be?
I don't think you should be embarrassed so much. I think more than anything else is that I'm glad he's finally there. Do you know what I mean? I don't want to make someone feel bad about it.
You're not going to lecture this guy.
No,
okay.
No. But what I will tell him is say, listen, let's get back on the ship a little bit for sure. But it happens to us quite often where someone will come, like they hear us on the radio, they'll see us on TV with a commercial or something, and they'll all of a sudden show up at the office with the console and saying, you know what, I heard you guys on the radio, and I haven't seen a dentist in X number of years. I know I need a lot of stuff done. Let's sit down and talk about it and get from there. And to be honest, I love treating those patients because they are going to see such a huge change in their health and their overall oral health and their confidence and their aesthetics that it's such a great service to provide.
And a lot of people, when they come to your office, can see a marked improvement right after the first visit.
Yeah, a lot of times.
Yeah. Now you do nasal lifts, you do bone grafts down there. What other things do you do? Put in teeth in a day? You have implants?
We do a lot of stuff. I'm trying to think what we don't do. We don't do braces. We don't do root canals. That's about it, basically, right?
That's about it. Orthodontics, that's right. Braces.
You don't do railroad tracks?
Don't do that. No.
My kids had those damn things during Expo 86 with the headgear and everything.
Yeah, we don't do that. Besides that, I think we do almost everything else. It's a lot of fun. We really do enjoy everything we do, and we provide all surgical services and all prosthetic stuff. The fun things that we can do is that not only can we provide services, we can provide them in one center. It's a one-stop shop. It's one place at a specialist level, and then on top of that, we're able to do something because it's one place in a much timely manner. So much more timely manner. So for instance, I've had some people rate me online where they said, I went to this office and they said it was going to be 6 to 8 months because I had to go here and then I had to go somewhere else and everything else. And we finished their treatment in 2 months, sometimes 2.5 months. Wow. It's a big difference for somebody, And something with teeth in one day, just this last week, I treated a patient that has been to multiple different specialists that had said that they needed to take bone from either her hip or somewhere else to be able to add bone in her mouth for her to be able to get anything done. And I gave her teeth in one day, in one morning. And it was amazing for her, and it was very challenging. Don't get me wrong; it was very difficult. But in the end, she walked out of there with a fixed set of teeth, and she'd been wearing a denture for probably a good set of 10 years. Beautiful lady, and just had just trouble with bone, and it was great though. In the end, we got a great result for her.
Now, you gentlemen have been doing this for a long time. Do you still enjoy a good challenge?
If I didn't, I wouldn't still be working. I get too many of my classmates retired, and I have to ask myself, what would I retire to, where I can get the benefit and enjoyment and appreciation of what I do.
What would you do? I mean, you'd just be laying around all day doing nothing, brushing your teeth.
I'd be here talking on the radio with you.
Anytime, you guys, anytime. Come on down. We haven't touched on this time, and we always like to do this just a little bit. We talk about dentures and implants and the difference between the two.
Sure. We actually this week we had a few dentures come to the office, so we could sit down and talk about some things. And dentures, are for lack of a better word, a piece of plastic that goes in your mouth that looks like teeth. But they're meant to sit down and kind of just rest on the gums of your tissue when you don't have any teeth. Implants allow for attachment so that when the dentures go in your mouth, they snap in and they stay in place. And also the best thing about implants for this situation is that you can imagine when you have teeth, you have roots in all of your bones, and that's what's keeping your teeth around. Whereas, everyone's seen an uncle or a grandparent, when they take the denture out, it's like their mouth is kind of caved in, their face is caved in. Well, the reason being is because they don't have teeth to stimulate their bone. So these dentures aren't stimulating their bone, they're pushing on the tissue, and they continue to have bone loss over time. Whereas if you have implants, they're in the bone, they stimulate the bone long term, help to keep it around just like a tooth would, and they allow to keep your dentures in place, which is great. And then we can take those patients and give them teeth in a day sometimes as well, which is amazing.
How long would an implant last? Just curious.
Potentially, it's indefinite.
Really?
It is indefinite. If you can keep it clean and keep the forces around it in a normal fashion, it'll last you the rest of your life. It's one of the few services in dentistry that has the potential of lasting you a lifetime.
It's something I tell my patients every week. I say, because we get that question all the time. It's, how much is it going to cost? Mm-hmm. How long am I going to have to worry about afterwards? How long is it going to last? And is it going to be painful? Like, those are the main questions people have. And understandably, those are the questions we have to answer every day. But sure. I tell my patients that if an implant goes in stable, it's restored well. That means the attachment or the crown or whatever goes on top of it's done well. And they maintain their oral health throughout their life, going to the hygienist, going to the dentist to be maintained. It'll outlast them a lot of times. The reason being is because you can't get a cavity on an implant, never need a root canal on an implant. There's a lot of things that implants are impervious to that's pretty good. They can get periodontal disease, but you got to keep things clean, of course.
Let's just talk about implants for a second. I guess a lot of people listening to the show, like I did at first, you talk about implants. Oh, it's a tooth you just screw in. Apparently not.
It's the root of a tooth. The tooth has got two parts to it. One is the root, which is embedded in bone structure, and that's surrounded by tissue and sticks out of the gum, and that's what you eat with. But we call that the crown and the root. The crown of the tooth is the part you eat with, and the root of the tooth is in the bone. And the two of them combined is a full one root tooth together. The implant that we put in replicates the root. That goes in the bone. And then we build teeth on top of it. We can build it in any number of different ways to suit whatever patient requirements are.
So you're talking about a permanent cure, whereas false teeth, because they're biting down on the gums and that's the gum. It's going to hurt after a while.
Let me see if I can create an analogy here that makes any sense.
Okay.
If you don't have any hair and you wear a hairpiece, a wig, and it sits on the soft tissue, the skin of your head.
Why are you looking at me? I don't.
You got all defensive.
You're one of the few people in the room.
I'm listening.
So the air. Well, dentures are that way. They sit on gum tissue, and we call them oral wigs.
We do.
No, we don't actually.
Well, I like that.
It's an analogy.
An oral wig. That's hilarious.
And that's sometimes why you see the advertisement on TV and in the magazines, these little cushion kind of things you put under there to sort of help a little bit if you can.
Sure. Yeah.
And they probably don't work worth a damn anyway.
Well, sometimes they do, sometimes they don't. It just depends on the patient.
Yeah?
Yeah.
Now, what days are you in the Vancouver office?
I'm there Monday, Thursday, Friday, and sometimes Wednesday. Mm-hmm. And then I'm Coquitlam Tuesday, Wednesday, most weeks.
Dr. Zokol?
I'm in Vancouver office Monday, Tuesday, Wednesday, and Coquitlam office on Thursday.
All right. Now, the number to the Vancouver office, if you've heard the good doctors on the radio and you'd like to make a consultation appointment, which is free, by the way.
Absolutely.
Just let it remind you. It's free. 604-872-0222 is the Vancouver office. 604-872-0222. And if you're in Coquitlam, it's 604-936-8244. In Coquitlam, 604-936-8244. You're listening to Boomer Life on Smooth and Easy, CL 650. We're back in just a minute with Dr. Bobby Birdie and Dr. Ron Zokol.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
Missing teeth? Don't want dentures anymore? Not happy with the way your smile looks? Dr. Ron Zokol can help. As an internationally recognized authority in oral implantology, Dr. Zokol is dedicated to all your dental care needs and can help solve your dental problems and help you achieve optimum oral health. Book your free consultation or learn more at drzokol.com. That's DRZOKOL.com.
CL 650.
Let a smile be your umbrella on a rainy day. And if your sweetie cries, just tell her that a smile will always pay. Whenever skies are gray, don't worry or fret. A smile will bring the sunshine and you never get wet. So let a smile be your umbrella. Be your big umbrella on a rainy day.
And in Vancouver, if you live here and you let a smile be your umbrella, you're going to get wet. But you're going to look good if you go to BC Perio, right, guys?
Absolutely.
Yeah. So people come to see you for all different reasons. Do people, when they come to see you at BC Perio Dental Implant and Health Center, do they actually need a referral from their local dentist?
No,
Really?
they don't. For example, some people, one gentleman came in last week to see me, and he had a bit of a problem, and requested for me to communicate with his earlier dentist, because there was some work that wasn't done as effectively as it could have been, and they were getting a little bit concerned. They wanted a second opinion as to where they go, and they asked me not to communicate. So it's not necessary. Anybody can come in, call and such, and we're happy to work with their referring dentist, or even if they weren't referred by their dentist, to communicate with their dentist to get the best results for them.
I just going to touch on something that I think is quite different. If you wanted to go see a specialist in medicine in BC, you have to go see your family doctor first. Then your family doctor's got to refer you over, and a lot of times that referral is only 6 months as a maximum before they can have to send another letter saying that you can stay longer. Well, in dentistry, you have the benefit of being able to go to a specialist right from the get-go, or a specialty clinic right from the get-go. So coming to BC Perio Dental Health and Implant Center means that you get to see multiple really highly trained dentists that are in the office, lots of specialists. I'm a certified dual specialist, and it's fun. You know, that's the one thing I think that we were able to do. Now, that doesn't mean we don't work with your general dentist. We work with numerous dentists that refer patients to the clinic, and we love working with our colleagues, but we are here to help you in any which way we can, and if that means you come in on your own accord, that's fabulous. We see that every week, and it's not out of the ordinary.
You mentioned going to the GP. The GP then makes an appointment for you with a specialist. It takes 6 to 8 to 12 months. Good Lord, you could die before that happens. If I was to call your office tomorrow, Well, I'll make it Monday because you're probably closed tomorrow. But I call your office Monday. How long would it be before one of you guys could see me?
I would say that it varies, but most times we keep slots open every week just for people that come in from the radio or from outside, or people that need to be seen right away. We try to get them in as soon as we can. We are booking out, a little bit of advance. I think we are getting very busy, but we want to make sure that we do well and that we do keep things open for as many people as we possibly can.
Now, that's nice because, like we said before, and Dr. Ron, you'll attest to this, if somebody's in pain, it's not a very fun time.
No. And those are the things I think we make time for.
We will make time for people who are in pain.
Nice.
Yeah, we did that this week. We had a patient that, bless her soul, she just got diagnosed with some cancer issues, and she's about to go into chemotherapy, and she had a couple teeth that were bad off. I saw her during one of her hygiene checks, and I said, I think these teeth probably should be removed before before you go on with the therapy. And she talked to her doctor, and he wanted it done, and I'm booked all the way up through until January. So it's one of those things where even though we were busy, we made sure that we made time for this lady to have her come in when she could, and we got it done. So we will make time for our patients if we need to, absolutely.
Somebody comes to your office, they sit down in the chair, you're looking for more than just teeth, right?
Mm-hmm.
Yeah. You doing a little inspection?
Well, the patient as a whole is our goal and their well-being. So if we find medical issues, for example, that are implicated by virtue of our examination, that's one of the things that we'll ask them to do, or phone their doctor, or have them go see their physician. It's about the patient, not so much by the procedures or things we're doing. So we're constantly looking out for the health and welfare of the patient as a whole.
And oral cancer screening is something we do with every examination. We do a thorough intraoral exam, make sure we look at things and try to catch as much as we possibly can. And the CT scan really is such a thorough, great tool that shows us so many things that we wouldn't be able to see with the naked eye, and you wouldn't even be able to see necessarily on a panoramic or even on a normal dental X-ray, because it's in 3 dimensions. You can see everything. It's amazing.
Is that quite common that somebody could come in and have other problems?
Oh, absolutely. We had one we had one patient that came in this week where he has a tooth that didn't come in, and he thought that someone came in and taken the tooth out, and he says, well, I've got this, I've always had this kind of little lump on the roof of my mouth, and we took a scan this week and we found that the tooth's still there. And we found that most of the tooth is still there. It's lying across his palate and underneath the bone, and it's still there, and it's something we're going to monitor and possibly take out in the future. But you would never be able to tell that from just an X-ray a lot of times because of the way it's oriented, because it's really high up, or from just a clinical exam.
So chances are there could be somebody else listening to this program that could have the same problem.
Possibly, yeah, possibly.
So that's not necessarily a bad thing, not a good thing, but not necessarily bad either?
No, I think knowledge is power. We want to know what we know, and getting the information and having the tools to be able to tell us what's there and what's going on that's half the battle.
What I like about your practice, too, if somebody comes to see you and they think they have problems, they say, well, Dr. Birdie, Dr. Zokol, I got this problem here in tooth number 24 and blah, 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 blah. You'll have a look, and you'll also tell them if they do not have a problem there.
Absolutely. So there's some, like, for instance, this has been a great week. Just yesterday, I had a patient that came in that has had some recession across his lower front teeth, and it was such an aesthetic thing for him. It was such a big deal to him that he had looked into getting his teeth out and all these things just because he was worried about this recession. He's a young guy, good-looking guy, in great shape, but it was such a bothersome thing to him that I said, well, why don't we do some tissue grafts, cover some roots, make things look much better for you and healthy, and you get to keep your teeth. But, it's one of those things that I told him that you don't need to have your teeth out. You don't need to do these things. We could do more invasive things, but this is not necessary for you.
Earlier in the show, our producer, Dwayne, was talking to you gentlemen about his impacted wisdom tooth. My question to you is, why the heck do we have wisdom teeth if we're not that smart? Well, I mean, we don't need them, do we? Did we need them back in history, or what happened there?
Hey, evolutionary-wise, I think we had as many as 4 molars at one time, and most people have 2, and some of us have 3, and some don't, or some people will have 4 wisdom teeth and some will have 1, 2, or 3. It's quite a variety, but we do seem to have a bit of a problem because evolutionary wise our jaw size is diminishing, but the tooth size isn't necessarily diminishing either. So people have crowding, big teeth, small jaws. This is where orthodontics comes in, and some people who they say are more evolutionary advanced don't have wisdom teeth. They have no wisdom at all.
So Cro-Magnon man comes to see you. Could people possibly have wisdom teeth in their head and not have any problems?
Yep, I have all 4 of my wisdom teeth in.
You don't?
I do.
Let's see. Oh yeah, he does. Look at that.
Yeah. All 4 wisdom teeth, and they're all. Now I see that a lot in people. But we also see people that don't have any wisdom teeth or have one or two or some of them removed. It's one of those things where it's that kind of factor that's variable in every person. And for some people, they get something that looks like a wisdom tooth, but it's not really a tooth, and it's just sitting there, and it just depends on the person.
And I want to compliment you, too. And he opened his mouth just like that when I asked, and your brushing technique is right on.
Thanks so much.
You're doing a great job. Just come back and see me in 6 months,
I will.
and you'll just be fine.
I will. Can you write me a prescription?
Oh, sure. What would you like? Little white pills? Yeah, make it feel good. So,
I'm leaving.
Oh, why? You have somewhere to go? Oh, you have a patient to see. We have fun on the radio, and that's one thing, and we like to talk about what you folks do, and that's another thing. But when people come to your office, you do take care of business. You listen to their concerns. You explain the procedure, but you also have some fun down there too.
Oh, I think so. And when you enjoy your work it's not stressful, and you're really taking the most out of it, which is the value to you beyond just the business aspect of it, and you enjoy the people you work with. That represents what we do, and we do have a good time.
Not only that, when you go to visit them at BC Perio, the coffee is free. Some of the best coffee I've ever had. Christmas is just around the corner, and I want to talk to you gentlemen about Christmas vacation and what people can do to ensure they have good dental health over the Christmas holidays. Right after this, you're listening to Boomer Life on Smooth and Easy, CL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL 650.
Missing teeth? Tired of your dentures? Not sure which dental solution is right for you? Dr. Bobby Birdie can help. A certified specialist in periodontics and prosthodontics, Dr. Bobby Birdie can show you your options and assist in determining if dental implants, teeth in one day, or implant-supported dentures are right for you. Book your free consultation at bcperio.ca. That's bcperio.ca. Find your dental solution with Dr. Bobby Birdie and Dr. Ron Zokol. bcperio.ca.
If you want to wake up feeling healthier, start at the place that strives to deliver the healthiest beds in Canada. Innovative Sleep Solutions. Owners Dave and Terry have over 50 years of combined sleep industry experience. They'll find you the perfect bed, and with their 120-night comfort guarantee, if it's not perfect, simply exchange it. Nature's Embrace, Restonic, Sealy, Serta, and Simmons, including the new medical magnet bed and certified organic latex. Now that's innovative. Innovative Sleep Solutions. They won't be undersold. King George Boulevard near White Rock. InnovativeSleep.ca.
It's true. There's no place like home. Shannon Oaks is your home, filled with love and peace of mind. An all-inclusive retirement community, Shannon Oaks offers independent living with delicious, nutritious meals, weekly housekeeping and linen service, 24-hour emergency response, daily activities and excursions to keep you active, as well as lovely gardens, lounges, and amenities for entertaining your family and friends. Learn more at shannonoaks.com. Book your complimentary lunch and tour by calling 604-324-6257.
CL 650.
When you're smiling, when you're smiling, when you're smiling, when you're smiling, and the whole world smiles with you. And when you're laughing, oh, you're laughing, and the sun comes shining through.
Dr. Bobby Birdie, did anybody ever tell you kind of look like Louis Prima, the guy that sings that song? You do.
No.
You kind of look like him.
I don't even know who that is, but I'll take your word for it.
Trust me. You know teeth, I know songs. Yeah, we're talking to typical great guys on the show. We do this about once a month, and it's well worth your time if you're having problems with your teeth or you think you might be having problems. Dr. Bobby Birdie and Dr. Ron Zokol from BC Perio Dental Health and Implant Center. 2 locations, one in Vancouver on Broadway at 777 West Broadway. That's at Willow. And the other is at 1175 Johnson Street in around Glen Drive in Coquitlam. And you split up your time, you go back and forth and see everybody and make them happy and take care of their teeth.
We do.
All right, now before the break, we said Christmas is just coming up as soon as you know. People will be getting together, stuffing their faces, drinking their faces off, having a good time. What about some tips from you gentlemen about how to take care of those teeth over the Christmas holidays?
I'd recommend taking care of them the same way you do every day, or supposed to do every day.
Or supposed to do, yes.
Yeah, I think that we can do it during this time of season. We get carried away with what we're eating and drinking and all that kind of course as well. But I think getting a toothbrush in your mouth and maybe some floss in your mouth before you go to bed, that's the most important time, is before you go to bed. So if we can get that going, that's great. Great stocking stuffer or a gift would be a water pick this winter, or this Christmas season would be great, because a water pick is I recommend them to all my patients because they really, really help with getting food out of the areas when you don't want to floss as much. And
so that replaces flossing?
It doesn't replace flossing,
No?
but I would say that it's as close to it as you can get. Let's put it that way.
Because flossing is, come on, it's pain.
Well, you know what? It's funny. I'll tell you when you talk to when you talk to people. There's a couple times that I meet people and I don't they don't know I'm a dentist, and they'll start talking about going to the dentist, and I'll say, yeah, how do you like flossing? And they're like, I don't do that. I tell my dentist I do it, but I don't do that, right? So the reason why I say a water pick's great is too because people they'll be compliant. It's just a fancy water gun for your mouth.
It's a toy.
Yeah, and it shoots water around. It'll get stuff out from underneath and beside your teeth, and it's great. So it's a good situation, and in all honesty, I think it's a great thing for that time of year.
You just made me think of somebody who doesn't brush or floss, and then they go to the dentist and they do it like maybe in the waiting. They go to the bathroom. The dentist will never know.
Yeah.
You guys know, don't you?
Oh, yeah.
The gum tissue doesn't heal because when you keep that debris around that gum tissue, it gets inflamed, and just because you take the debris away doesn't make it healthy. It takes time. You got to be doing it for a while before that gum tissue becomes healthy. So don't think you can fool a dentist by brushing the day beforehand or something like that.
Because these dentists were born yesterday.
Yeah, but it's better that they go in brushing their teeth and then coming in just having lunch too. So
yeah,
right. So I'm okay with them going after the day before or the day of. It's fine. At least they're showing some effort. I don't mind that whatsoever, and it helps me out.
Well, you're a good sport, and because you are a good sport, let me pass this along. Here's a little tip for dentists. Okay. We have lunch. You guys go and have lunch, right? Mm-hmm. Try not to have garlic. Hi, can I see you? Oh,
I hear you.
You know what I'm saying?
Yep.
Brings tears to your eyes.
Yeah. So it's a two-way street. But you guys don't do that. I know you don't.
We got masks on.
Yeah, you do too. You do too. So it's a Christmas time. So take care of those teeth. Brush, water pick it, floss. Do what you got to do.
And don't forget that enjoy the water pick and its benefits, but don't not brush.
Yep.
Okay.
Got to brush. Got to floss.
Replacing water picks.
And any way you can get a piece of floss in your mouth. So if it's not the string and you're using your fingers, they've got ones that come on like little tiny little horseshoes that you can use those. Some people use these go-between little picks. Anything that you can do to get in your mouth and clean things better besides just brushing is going to help. So we'd love for you to floss all the time, but if that's not going to be something that's that you're going to be able to do, then water pick's great. It's a great adjunct if you are flossing as well, or also just any kind of other aid is really going to help you.
Any advantages to an electric or battery-operated toothbrush over the old manual thing?
From my perspective, absolutely.
Yeah?
I think all in all, for whatever time you spend with your mouth, it's all technique. And if you get an electric toothbrush in the right spot in your mouth, it's going to do a better job than the hand toothbrush, unless you're incredibly good with a hand toothbrush.
I would say that all the studies show this as well, is that electric toothbrushes are better. They're better at removing plaque. They're better at cleaning. Compared to, and if it's the same person using it back and forth. So electric toothbrush is great. It's what I recommend to all my patients. The best thing about them is twofold. Number one, they have a timer on them most of the time, so you want to brush your teeth for about 2 minutes. That's one song normally.
Happy birthday twice.
Yeah, it's one song, or it's got a timer on them, so the brush will tell you. And the other thing too is that if you push too hard with the electric toothbrush, normally it'll either have a sensor or it'll stop. Which is great, so you can't do as much damage. Whereas with the manual toothbrush, you can just give her, right. So you want to make sure that you have that. Those are the benefits, I think, of electric toothbrush.
Yeah,
that was a good point too. You got to watch the amount of pressure you're putting on your teeth when you're brushing them.
Yeah, and the bristles that are there on the brush as well.
It's not like scrubbing a basement floor.
No, it's not. No. And the irony is that some people who have been over diligent with a manual toothbrush have damaged their tissue so significantly they need a lot of dentistry done to repair it.
They can wash away the...
Well, they can scrub away, and depending on the type of toothpaste they use and whether it's abrasive or not, they can wear away tooth structure and wear down gum tissue and things like that. So
I'll tell you, as a periodontist, the tissue grafts that I'm doing most of the time are on patients that have good oral hygiene, but they brush too hard, especially in the upper corners or lower corners of their mouth, and they brushed away a lot of their gum tissue that we've got to repair. So it's not that they're not doing a good job; they're just being a bit too aggressive.
All right, now if you've been listening to our show this morning, we thank you for that. And if you think that these two guys that are with me are the cat's meow when it comes to teeth, which they are, you might want to give them a call Monday. Dr. Bobby Birdie and Dr. Ron Zokol, BC Perio Dental Health and Implant Center, 2 locations, one in Vancouver, one in Coquitlam. Gee whiz, listen to this music. I feel like I'm in your office already.
I was trying to kick you off.
Yeah, 777 West Broadway at Willow. The telephone number there is 604-872-0222. The other location is 1175 Johnson Street, Unit 250, Suite 250 at Glen Drive. In Coquitlam, the telephone number is 604-8244. Your website, bcperio.ca. You can get all the phone numbers and information there, right?
Absolutely.
Yeah. So you getting ready for good Christmas?
Trying.
Will you have your family be bigger by Christmas? Do you know? Any second now?
I don't know yet. Any second now.
Yeah. I'm not a doctor, but I'm saying any second now. So you go home, you may have a surprise.
That's awesome.
Gentlemen, have a wonderful Christmas.
Thank you, Tom.
You too.
See you again soon.
Take care.
And I'll see you at your office. And Dwayne, thank you very much. Go get those teeth unimpacted, if there's such a word.
Will do.
All right. I'll see you Monday morning at 6 a.m. on the Sterling Fox Show. Enjoy your weekend. It's Tom Lucas. Thank you. Bye.
Bye.